And while we're all focused on COVID-19, a team of Limpopo surgeons has not forgotten other health issues requiring attention. As part of a provincial rural health matters program, Dr Thendo Netshiongolwe has performed a successful 5-kilogram breast reduction surgery at Letaba Hospital. We're joined by him right now. Thank you for your time. Please tell us, what was the complexity here that you had to deal with?
Evening, Omar, and all to the listeners. So breast reduction operations, by nature of being a plastic surgeon, routine operations that we do operate. The challenge in this instance is that we wanted to decentralize services, especially tertiary services, and take it to the people. So instead of operating on these patients in big centers or in tertiary centers like Polokwane, we decided to go out there and perform the operations next to where the patient lives. The advantage of doing this, of course, of taking rural health matters to the people, is that number one, we are able to reduce on the surgical backlog that is faced by tertiary hospitals. So with the extent of COVID, surgical stays were stopped, so we have a huge backlog. So when we go out there, we are able to cut down on the backlog. And studies have shown that, like, if people stay with their ailments for a longer time, the outcome is worse. The second point about this project is that when we go out there, we are able to transfer skills. So we teach those doctors in those district hospitals and the nursing team in those district hospitals how to deal with complex operations and how to make this routine in their centers.
So let me understand.
We make sure that these patients are operated next to where they are, so they don't have to travel long distances to come to us, but then they get the psychological support from their relatives who don't have the money and the time to travel to us. So we do this in their doorstep.
Dr. Netshiongolwe, let me ask you this, though. What is the resource that you're able to take? I mean, do you have a mobile clinic that you are working with in order to, let's say, outsource this process from hospitals that are overwhelmed with COVID? What exactly is it that you do? What do you take out?
So basically, the first important resource that we send out there is the team of specialists, called the specialists in Limpopo. Department of Health are willing to be part of this. So we all go out there as the first number one resource that's required. We do invite other specialists from other provinces, like Prof. Golele always comes, joins us. Prof. Rubengo from West joins us. So those are the resources that do support this project. And then the number two thing that we bring out with is the surgical consumables. In terms of the infrastructure of theaters that we need to use, Limpopo has got good infrastructure. We've got good theaters in district hospitals that are often not used, that are only used for cesarean section, because the other complex operations will get sent through to tertiary hospitals. So when we get there, we find good facilities to operate in. We just make sure that we take all the consumables that we need, which the sisters from tertiary hospitals packs for us. This includes things like sutures. It includes things like the surgical trays that we use to operate on. So those are the resources that we do take in, which we just put in our cars. We don't go there with mobile clinics. We make use of the district hospitals that are available in the province.
Are there any risks that are increased because you are outside, say, the major provincial hospital and you are performing complex operations?
Yeah, there is often that risk. What we do is when we go out there, the initial days that when we are there, we always screen on our patients, and then we make sure that it is safe to go ahead and do those procedures out there. Like, for example, on Thursday, we were supposed to operate on a child with cleft palate, but the tubes that we were having were not enough. Were not suitable to carry on with the operation. So we had to abandon the operation and then fetch the correct tubes on Friday and go back and operate. So we do make sure that we do take all the precautionary measures. And of course, as I said, usually we travel with a team of all specialists that are required to carry out all this complex operation. So that will be the anesthetic team, that will be the nursing staff, any support services that people out there who are not used to performing this will need, we carry it with. And of course, if we see that the procedure is complex and it cannot be carried out there, either because of need of ICU post-operatively, then we'll send those patients back to our tertiary center and we'll operate on them in the tertiary center.
Finally, what are the most common operations that you are performing in this way by leaving the provincial hospitals and really getting out to where the people are? What are the most common operations?
Yeah, from the plastic surgical side, I'll speak from our side. Mainly, the most common operation that we do is keloid operations, because we find that a lot of patients with keloids stay in district hospitals, and they're not able to access help in our side because of the backlogs that we have. And the other one is breast reduction operation, which is also an operation that's close to my heart, because like often at times it's not covered by medical aid. So you find that patients that are on medical aid will also come and make use of our facilities. So by far, those are the most commonest ones that we do. We also offer cleft surgery. So we also perform cleft lip and cleft palate when we go out on these missions. So those are the three most common operations that we do carry out.
So when you are going out to these rural communities, and of course we're talking about the poorest of the poor communities often, what sort of cost is it to them for these sorts of operational procedures that you're performing?
Yeah, the cost is, I can say, is free to the end user. Firstly, because all the surgical, the specialists that are involved in the project do this pro bono, so we don't get paid to do this. We travel, we use our time away from our family on weekends, and we go operate on these patients for free. And in terms of the hospital, they're using the available hospitals, district hospitals, regional hospitals that are made available by the Department of Health. So they come there and we operate on them for free, I can say, to the end user.
And I think just for our viewers to understand the kind of good work that you're doing, what would it cost this sort of operation? What would it cost in a private hospital?
So an operation like a breast reduction, I'll just give an average figure, because like it also depends on the experience of the surgeon, where they are operating from, and then the cost can go high based on that. But like on average, a breast reduction will cost in the region of about 80,000 to the end, 70 to 80,000 on average.
Thank you very much. So that's really good work that is happening in that district. Thank you very much for your reporting on that and giving us an insight into the amazing work that you and your surgeons are doing.